Live, sir? Okay, okay, Ji. Fine. But I'm unable to see the screen.
Now check, sir.
Uh,
Click on the link, sir, once.
okay, I'll close it and I'll open it once again. Yeah, it's visible. Okay, Ji. I'll cut the call. I'll finish the recording. All right. Okay, Ji. Thank you. So yeah, hello doctors. Let's take up the NEET 2025 physiology questions. Let's go through these questions, options, why certain option is right answer, why other choices are not the right answer. Let's have a clear idea here. Now, this is the first question that's been asked. The question started with a clinical history of a patient, and the history was so clear that we could able to make the diagnosis of pulmonary embolism, and along with that clinical history and the word pulmonary embolism, we got an image, and the image was a complaints graph where the image was a gas tensions graph where on the x-axis we had partial pressure of oxygen, on the y-axis we got partial pressure of carbon dioxide, and these two values are given, and we were supposed to pick the right answer for the question. And in this question, since the topic is all about pulmonary embolism, we got to identify at what point the graph indicates pulmonary embolism. Is it point A, point B, point C, or point D? Normal is already given in the image itself. Now we are supposed to pick the right point in this graph. So in order to solve this question, let's first get the answer, and then we keep understanding why certain point is the right answer. Anyway, let's start with the right answer here. It is going to be point D. Point D is the right answer for this question. Guys, when it comes to pulmonary embolism creates a condition where an alveoli will be ventilated well, but the perfusion to that particular alveoli is completely compromised. So we have an alveoli which is perfused by a pulmonary capillary, and if there happens to be any thromboembolism, venous blood doesn't get into this capillary, so that there is no gas exchange. Point number one, you're going to recognize this one condition, that there is going to be no gas exchange, guys. So what is going to happen to the alveoli and the blood? Usually we expect oxygen to be transferred out from the alveoli into the capillary, and carbon dioxide should be transferred out from the capillary into the alveoli. This is what we usually expect. But since there is no flow going in, into this one particular blood vessel, we are not going to have both these events. There is going to be neither diffusion of oxygen, there is going to be nor diffusion of carbon dioxide. All right, doctors. So what is going to be the consequence here? If a subject is not going to expire carbon dioxide, see, atmosphere has got no carbon dioxide, doctors. Just be clear in this one point. When it comes to atmospheric gas, this atmospheric gas, 70% of atmosphere is made of nitrogen, close to 21% of atmosphere is made of oxygen, and on an average of 9% of atmosphere is made of inert gases, argon, boron, krypton, all these kinds of inert gases. 0.003% of atmosphere is made of carbon dioxide. We can practically ignore this 0.003%, guys. So if you are supposed to look at the presence of gas in a alveoli, all right, so we'll put it this way, right, doctors? I hope you could able to still see me. I'm sorry for this one small technical glitch. Yeah, if you look at this one gas tension, you're going to observe this. The air that is getting into this alveoli, all right, the air that is going to get into this alveoli will be having no carbon dioxide. So the only source for carbon dioxide in an alveoli is going to be the venous blood. Only when venous blood comes in, it is the carbon dioxide of venous blood which is going to go into the alveoli. If there is no venous blood coming in, alveolar carbon dioxide level will be very less, Alright, so that's going to be point number 1. You should be clear about alveoli will not going to have carbon dioxide in it. Number 2, look at the oxygen. The incoming air will be coming with plenty and plenty of oxygen. Since the blood vessel is blocked, you are not going to have RBCs which is going to run in this capillary. Since you are not going to find any RBC travel into this capillary because of this blockade, the oxygen in the alveoli will not be taken in. Since there is going to be a compromised oxygen delivery to the capillary, the oxygen present in the alveoli will be completely unutilized. It will be completely fresh, untouched in the alveoli. So what are you going to observe? There is no oxygen extraction, there is no carbon dioxide delivery. As a consequence, the carbon dioxide level will be very, very low. So in this graph, you can see y-axis speaks about carbon dioxide, isn't it? The lowest point of carbon dioxide is here, that corresponds with point D. And when it comes to oxygen, that's going to be represented in x-axis. Here it is 40 millimeters of mercury, 100 millimeters of mercury, 150 millimeters of mercury. So in such a conditions of unutilized oxygen and unexchanged carbon dioxide, the partial pressures of gases in the alveoli of oxygen will be close to 150 millimeters of mercury, and partial pressure of alveolar carbon dioxide will be very, very less. It's going to be close to 0 millimeters of mercury. So that exactly corresponds with option D, guys. So point D, and or in another sense, option D is going to be the right answer for this one question, doctors. All right. Anonymous, not 9. I think alphabets are in reverse order, whatever it is. But even though the alphabets are in the reverse order, it doesn't matter. The point is this one, guys. You have to pick up the point which is here, isn't it? Which means at the rightmost corner, like this. Consider this as a square, and you got to pick the point which is in the right side lowermost quadrant. This point corresponds with a V by Q ratio of infinity, where there is going to be zero blood flow. This is going to give you V by Q ratio of infinity. Here it is going to be V by Q ratio of 0. This is normal, where the V by Q ratio is going to be close to 0.6 to 0.8. And let's take this, the maximum value 0.8. So this is the curve that's been asked, and this is the way you got to answer this question, guys. Even if someone of you are watching for the first time, it's a very easy question. All you need to understand is this one point. Atmosphere has got no carbon dioxide in it. So if a subject is inhaling atmospheric air, the air that comes into the alveoli will have no carbon dioxide. All right. So Balam Kansoni, yeah, that's okay. You must be having the graph going like this. So it's going to be A, B, C, D. All right. So thanks for this update. In case if you are getting this graph like this, consider A here, B here, C here, and D here. If this is been the way the graph has been displayed, then obviously, as Dr. Anay Goyal was saying, A happens to be the right answer. If it is the other way around, then D happens to be the right answer. But anyway, guys, the point you got to take into consideration is the right lowermost point. I hope first question is clear for you all, and let's move on to the second question. The second question speaks about hormonal levels in day 21 of menstrual cycle. Now, day 21 is somewhat about a week after ovulation. 14th day is ovulation, and 1 week after ovulation, what is going to happen? Now, the point is, once the ovum has been ruptured out of the maturing follicle, the cumulus oophorus cells would have been ejected out of the developing oocyte, and all these cells are gone out of that ovum, and now it's going to be simple corpus luteum. Now, corpus luteum will be keep on producing two hormones. One, it is going to be progesterone, and the second one, it is going to be estrogen. Since there is going to be a continuous production of progesterone greater than estrogen from corpus luteum, you will find increased values of progesterone, slightly lesser values of estrogen. So that's the way estrogen and progesterone levels are going to be represented. So if you correlate that with day 21 in a menstrual cycle diagram, you can understand this picture clearly. It is going to be day 21. You can see the highest value, the red one, corresponds with progesterone. So this picture, this line corresponds with progesterone here, and the blue line corresponds to estrogen, guys. The blue line corresponds to estrogen. So that's going to be first two hormones. So definitely estrogen and progesterone levels will be comparatively higher. Now, just because estrogen and progesterone keeps getting higher, they will exert a negative feedback action over FSH and LH. So the hormonal levels in mid luteal phase or late luteal phase is going to be this. there will be increased progesterone, there will be increased estrogen. As a consequence, there is going to be very little FSH and LH. So these two lines indicate FSH and LH, guys. So obviously the answer for this one question is going to be option C. It's going to be low FSH and it's going to be, option D here. It is going to be low FSH as well as low LH. That's going to be the right answer for question number 2. Hormonal levels in day 21 of menstrual cycle. I hope second question is also pretty simple and straight. I hope there is no controversy in question 21 as well. Question second as well, guys. So let's move on to third question. People, let me be clear. When it comes to question number 3, I received 2 sets of questions from my students. This is one question. What you are seeing is one question. Question number 1 is this, where the question was asked us to identify capillary oncotic pressure. That is one set of students' opinion. And the other set of students were giving me a different question, where the question was asking us to calculate interstitial fluid hydrostatic pressure. So I have received 2 sets of questions from my students, so it's better I address both the sets of both the questions, so that you be clear and thorough with the way with which you got to solve this question, guys. So let's take up the first question and let us take up the first method. People, this is a very simple question about Starling forces. So this question is all and all about Starling forces, guys. So when it comes to Starling forces, it's simple. You can understand that if you are looking at the process of filtration, guys, the hydrostatic pressure, which is represented by P in the capillary, will be driving the fluid out of the capillary, and the oncotic pressure, which is represented by pi in the capillary, will be pulling the water into the capillary. So within the capillary, hydrostatic pressure favors filtration, oncotic pressure prohibits filtration. On the opposite side, if you take up interstitial fluid, the hydrostatic pressure in the interstitial fluid, guys. All right, so let's take up the interstitial fluid hydrostatic pressure, and if you consider interstitial fluid hydrostatic pressure, the pressure here is going to resist filtration or oppose filtration, whereas oncotic pressure in the interstitial fluid will be pulling the water out of the blood vessel. It will be favoring filtration. So this is the way the filtration is going to be happening, and these are all the net forces, guys. So when it comes to net force, in another word, when it comes to net filtration forces, you have to take into consideration 2 factors. Number 1, you got to take into consideration factors that favors filtration. That's going to be number 1, and you got to subtract factors that opposes filtration. Factors that favors filtration as well as factors that opposes filtration, you got to take into consideration both, so that you get something called as net filtration pressure. But interestingly, the question says there is no fluid movement. If the question is very clear about no movement of fluid, it's obvious that the forces in the capillary as well as forces in the interstitial fluids are going to be equal and balanced, which is why the fluid is neither flowing out of the capillary, the fluid is nor flowing into the capillary. Both these sets of movement is perfectly stopped, because the forces on both sides of the capillaries are going to be equal, very equal. So with this in mind, you have to take into consideration whatever the forces your question paper is giving. Balumkant, yeah, 27 IOP, 18 COP, 7 COP, 7 CHP. Yeah, this is exactly. When it comes to first set of questions, the value was not very accurate as you guys were saying. All right, it was 25, 23, 0. If you substitute all these values, doctors, just for a moment, let me make this very clear. The first question that you are solving is going to be based on a different value sets, 25, 23, 0, and you got to calculate what is the value for capillary oncotic pressure. That's one set of values I received, and the second set of values is here. Capillary hydrostatic pressure is going to be 18 millimeters of mercury, oncotic pressure 27, interstitial fluid oncotic pressure 7, and you are supposed to recognize and identify what is interstitial fluid hydrostatic pressure. So if you substitute these values, and the same logic here, factors favoring filtration, Capillary hydrostatic pressure favors filtration and the value is 18 millimeters of mercury. Interstitial fluid oncotic pressure favors filtration and the value is 7 millimeters of mercury. The net value is going to be 25 millimeters of mercury. On the opposite side, factors opposing filtration. What are the factors that prohibits filtration? If the interstitial fluid has got very high pressure, that is 27 millimeters of mercury, and if capillaries do have more proteins, they exert oncotic pressure, and that's going to be some X amount of value, and people very sharp. It's an easy question. Please remember, the fluid is not moving, which means the forces are equal. So I must have 25 millimeters of mercury in this box so that there will be equal amount of force that favors filtration. Forces favoring filtration is also going to be 25 and forces opposing filtration is also going to be 25. So if I need 25 millimeters of mercury, what value should I be getting in this box, which is highlighted by question mark? The interstitial fluid hydrostatic pressure is 27. So what must be the capillary oncotic pressure? Now it is going to be minus 2 millimeters of mercury, so that 27 minus 2, you are going to get 25. So for this question, if the values are given like this, 18, 7, 27 and the x value, it is going to be minus 2, guys. So for this question with the values given like this, minus 2 millimeters of mercury is the right answer for this question, guys. So this is right answer for this question if the values are 18, 27 and 7. And just for the sake of discussion, I'm asking, just for the sake of discussion, now can you tell me, if the table is being given like this, where capillary hydrostatic pressure is 25, if let me be clear here, so if the values are substituted like this, capillary hydrostatic pressure is 25, interstitial fluid oncotic pressure is 0, interstitial fluid hydrostatic pressure 23, can you guys tell me, can you answer what would be the value for capillary oncotic pressure if the values are given like this? So let me wait for a second, if you could able to come up with any answers, guys. Yeah, very good, Balumkand, very good. If this is the case, you are going to get plus 2 millimeters of mercury. Very good, superb. And so that you will be having the total of 25 millimeters of mercury. It's a beautiful question, pretty easy question, and the values and the answer is dependent on what kind of values the question were bringing up. So that is question number 2, and that takes us to question 3, guys. In prolactinoma, the action of prolactin in causing amenorrhea is option A, downregulation of estrogen receptor, B, decreasing gonadotrophin releasing hormone, C, decreasing FSH, increasing pulse frequency of LH. Now people, if you watch close, option A, option B and C, all the 3 choices will be leading to amenorrhea. There is absolutely no doubt about it. All the 3 choices will be leading to amenorrhea, but the question is pretty clear. The question asks about a condition where the subject is experiencing prolactinoma. In this situation, what could be the reason behind amenorrhea? So here it is all about excess of prolactin. Now every time if there is going to be excess of prolactin or even prolactin in normal levels itself, this is the response, guys. Prolactin do have a inhibitory effect over hypothalamic gonadotrophin releasing hormone producing neurons. If gonadotrophin releasing hormone producing neurons are suppressed by prolactin, there is going to be no GnRH release. There is going to be no gonadotrophin releasing hormone. As a consequence, there is going to be no production of FSH and there is going to be no production of LH. So on both sides, if you watch close, the hormone responsible for growth of ovum is also cannot be produced, estrogen cannot come out, and the hormone which is necessary for ovulation is also not going to happen. That's going to be LH, guys. So end of the day, the best answer for this question is going to be decreasing gonadotrophin releasing hormone. That is the best answer for this question, guys. In prolactinoma, the reason behind amenorrhea is going to be decreasing gonadotrophin releasing hormone, guys. Now just one added point, just be familiar with this. The way prolactin inhibits hypothalamic gonadotrophin releasing hormone neuron is a little bit tricky and different. Just to complete the answer, we have a set of neurons, and this set of neurons are going to be called as kisspeptin neurons. So it's a point you have to be clear about. So these neurons are called as kisspeptin neurons, again located in hypothalamus itself. This kisspeptin neurons do have a excitatory effect over hypothalamic gonadotrophin releasing hormone producing neurons. But interestingly, the hormone prolactin goes and inhibits the kisspeptin producing neurons. Just because this one group of neurons are getting inhibited, kisspeptin producing neurons are getting inhibited, the stimulatory effect over GnRH is getting lost. As a consequence, GnRH is not going to be produced. So that's the way the action has been executed in a very clear and sharp manner. So Shaurya, very right answer B, decreasing GnRH is the very right answer for this question, guys. So let me keep this option open for you so that you get the clear idea of the question itself. That's going to be question 3, that's prolactinoma, guys. Moving on to question 4. Pretty simple and straightforward question. Amiodarone, which is a potassium channel blocker, acts on which phase of cardiac myocyte action potential? Right? It's very simple. We have phase 0, that's depolarization, phase 1 immediate repolarization, phase 2 plateau, phase 3 final repolarization, phase 4 resting membrane potential. And when it comes to phase 3, which is mediated by potassium efflux, that's exactly where potassium channel blockers are going to be acting. So the answer is going to be choice C, that's going to be phase 3, guys. So let's take this one as the right answer for the question. It's going to be phase 3. So yeah, that's going to be questions on amiodarone. And moving on to the next question. Here again, my students were saying two different sets of ideas of two different sets of inputs. Number one, some students were saying that sir, the graph was given and we were supposed to identify this one point and the point corresponds to optimal length. This is one set of questions I've received. And the second one is this, where along with the graph, along with the bell-shaped curve, we also got the thick filament and thin filament interaction curve as well, and we were supposed to identify which curve corresponds to the maximum tension development. So I received two kind of questions from my students. So you guys, you are there, could you I hope you could able to tell me the better answer. So whatever the graph it is, people, let's get to know the answer for this question. So it's a simple length tension relationship curve. It's going to be talking about length of sarcomere and the contraction or the tension produced by this sarcomere. So it's going to be a simple length tension relationship curve. On the x-axis, it is going to be length of the sarcomere. At this length, you can see that the force of contraction is going to be maximum, and the curve, the point where the force of contraction reaches a maximum is going to be called as optimal length. And for this question, A, optimal length is the right answer, guys. So the length at which the force of contraction or the tension generated is maximum, that point is going to be called as optimal length. That's one set of questions. The next one is going to be here. Identify the correct option from this length tension relation curve where the developed tension is maximum. Again, it's going to be point C here. If this happens to be point C, you're going to see a perfect overlap of thick filament and thin filament. Both these filaments comes for a perfect overlap. Alignment of thick as well as thin filament. And if the question is being asked in the other way around, the answer you're supposed to pick is going to be point C. That's the right answer for this question, guys. All right, so it's a pretty simple and straightforward question, and I think you are clear in this one question, guys. Let's move on to the second one. Again, this is a question where I couldn't able to get the last choice. People are still confused with this question. Which hormone is responsible for hyperpigmentation in Addison's disease? So I'll keep the choices open. If your question we're talking about alpha melanocyte stimulating hormone, that is supposed to be the best answer for the question, guys. If the question doesn't speak about alpha melanocyte stimulating hormone, the next best answer is going to be adrenocorticotrophic hormone. People in Addison's disease, the point is there is going to be no cortisol. Of course, every single adrenal cortical hormone production goes down, but for our discussion, absence of cortisol is going to be the prime point here. If cortisol is deficient, the consequences, there is going to be no negative feedback. It is the cortisol which is going to be the hormone for negative feedback pathway in this cortisol axis. If that hormone is compromised, there is going to be no negative feedback. As a consequence, there is going to be increased production of a hormone called pro-opiomelanocortin. This hormone, pro-opiomelanocortin, is going to get cleaved into two subproducts, Number one, it is going to be adrenocorticotrophic hormone. Number two, it is going to be alpha melanocyte stimulating hormone, guys. I repeat, these two hormones are coming out of a same precursor, and that precursor, doctors, is going to be pro-opiomelanocortin. All right, that precursor is going to be pro-opiomelanocortin. As a consequence, they have a astounding structural similarity. So when it comes to the cells called melanocytes, ideally speaking, the best hormone that could able to exert its action over melanocyte is going to be alpha melanocyte stimulating hormone. That's the best hormone that exerts its effect over melanocytes, guys. That's number one. All right, number one. And to a very little extent, adrenocorticotrophic hormone will also has got a very minimal effect on melanocytes. For God's sake, remember this. You have to pick alpha MSH if the word was given. If it is not given, the answer is going to be ACTH. So that day my students were saying the presence of alpha MSH was not given in the option, so we go with the best choice. That's going to be adrenocorticotrophic hormone for this question, guys. Plain and simple. Moving on to the next one. A subject reaches high altitude suddenly. Few days later, he was diagnosed as having cerebral edema. Identify the correct mechanism behind this pathophysiology. It's a one-liner, straightforward one-liner. Just because there is a drop in atmospheric oxygen, there will be a corresponding drop in alveolar oxygen. As a consequence, there will be a drop in arterial oxygen. So every time when arterial oxygen level goes down, this hypoxia is going to induce vasodilatation, and A is the right answer for this question, guys. Low arterial oxygen induced cerebral vasodilatation, and that's the reason behind cerebral edema. I hope you are aware of what happens to pulmonary artery. While cerebral vessels are going for dilatation, there will be a concurrent pulmonary vasoconstriction. All right. So just be clear on that one aspect, guys, and that is going to take us to the last question. A subject climbs on high altitude mountain. He was breathing heavily during his trek. What change would be expected on his arterial pH? Plain and simple. This subject is going for hyperventilation, isn't it? So here we are seeing a subject who is hyperventilating, and because of this hyperventilation, there will be a carbon dioxide washout. And because of carbon dioxide washout, the raw material that is necessary to synthesize carbonic acid comes down, and obviously the answer for this question is going to be respiratory alkalosis, and that's the question from high altitude. Two questions, guys. One is the acclimatization leading to high altitude cerebral edema, and the second one is going to be respiratory alkalosis. So that completes the discussion, guys. If you got any doubts or if you need any more points to be added or anything to be discussed, please do let me know. If not, that's the end of the session. The PDF and all the notes will be with the tech team, and they'll be uploading the questions with the choices, everything very soon. So that's the end of the session, guys. Thank you very much. I'll wait for a minute. If there is any doubt, please do express your doubt in the chat box. If not, we'll close the session, guys. Balmukund, value given pH 7.2, carbon dioxide 55. Perfect. Then it makes perfect sense. It's going to be 7.2 of pH and carbon dioxide is going to be 55 millimeters of mercury. It's an inverse relationship, right? So every time you see partial pressure of arterial carbon dioxide in an inverse relationship with pH, which means if pH is increasing, PCO2 should be dropping down. If pH is dropping, PaCO2 must be pulling up. All right. If you find this inverse relationship, obviously, this is a clear-cut case of respiratory disorder. So there is no doubt about it. So since you find the inverse relationship, clearly it is a case of respiratory, acidosis. That's a separate question, doctors. Just please remember, this is a completely separate question. Why I am saying this is, if a subject is climbing up and if the subject is hyperventilating.
Good evening, everyone. How are you all doing? The NEET PG is finally over, and I know the emotions must have now become better, and so you must be wanting to go back to how you did and what you did and what it meant for you, and how you are going to plan your road ahead, right? So based on that only, I'm going to start the discussion of this year's NEET PG anesthesia questions. If I'm audible and visible, just give me a thumbs up. If I'm audible and visible, just give me a thumbs up.